Sure. So, a little background for our study is that oral tongue cancer has traditionally been a diagnosis associated with older age as well as habitual tobacco and alcohol use. However, in the past few decades, there's been a disproportionate increase in oral tongue cancer in young patients, particularly in those without a prior history of significant alcohol or tobacco use. In the literature, these young patients without traditional risk factors seem to represent a distinct clinical entity with worse oncologic outcomes. So, the purpose of our study was to compare young patients aged 45 or younger to older patients with oral tongue squamous cell carcinoma without history of tobacco or alcohol use. To do this, we retrospectively reviewed clinical and pathologic characteristics as well as outcomes in all oral tongue squamous cell patients at our institution. And ultimately, our analysis showed that older patients actually presented with more adverse pathologic findings at time of surgery, such as advanced stage, greater mean depth of invasion, higher incidence of close margins, increased positive nodes, and lymphovascular invasion. However, despite these more aggressive pathologic features, the younger cohort also had significantly higher rates of local, regional, and distant failure compared to older patients. So we concluded that young patients without traditional risk factors appear to represent a distinct, more aggressive clinical entity. So, one question that we've received is where local regional failures occur in these young patients. They had higher local regional failure rates, and we actually have started to investigate this using a PET scan as well as prior plan and CAT scans that we acquired in patients who received radiation. So, we've actually found that almost all young patients demonstrate in field failures, meaning recurrence has tended to occur in areas